Hello，主里弟兄姐妹、长辈们，大家主里平安。那么今天很高兴有 Dr. Tiong 在我们当中为我们分享这个临终关怀。那么在此之前，我们也谢谢他能够抽空时间来到我们当中。我们这里就好不好给他一个掌声，就是谢谢他。OK， 好。那么在开始之前呢，我们先请小娟牧师来为我们做一个开始祷告。我们请。
Gracious God, Heavenly Father, we are thankful to you whenever your children are gathered together. We thank you for this evening. We thank you that we're able to gather and to listen to the sharing by your faithful child, Dr. Tiong. We pray that God, you will anoint him, you will use him as he touch on this very useful and yet sensitive topic. And so we ask for your presence, we ask for your anointing, and we ask that God, you be with all of us, that we can learn and that we can be channels of your love and grace to people around us. And so we commit this evening's session into your hands. In Jesus' name we pray. Amen. Okay, I'll now invite Dr. Tiong to come and give us a talk. Yes.
Good evening, and thank you, Pastor Lenita and Mr. Young, and thank you for the church to give me this opportunity to share. First, let me just, we look at this particular topic, okay? The topic is called palliative care, and sometimes we also call it hospice. I think there is slight difference, but as far as we are concerned here, we take it as the same, okay? So palliative care or hospice care, if you Google translate, it's called 临终关怀, okay? But a lot of people don't like this term called 临终关怀 because it says it's very sad, 临终, you know? So sometimes they translate it to 安养, 安宁关怀, okay? So, but essentially we're talking about care for the very ill or sometimes terminally ill. But we also don't like to use the word terminally ill because you really do not know when the time is up really, okay? So we actually just care for those whom actually recovery is not really in the horizon, okay? We're talking about care for people who we know have a limited lifespan. How do we know it's a limited lifespan? We look at the sickness and we more or less make a guess. Of course, we cannot be right all the time. And we take it from there, and one thing at a time. I actually is a volunteer doctor with the National Cancer Society Sarawak branch. Okay, I have been with it since probably 1998 or 97 until today. Okay, so first of all, I just share with you how, as actually my practice is dealing with eye, which really has nothing to do with palliative care, right? But in 1997, 98, unfortunately at that time in my church, we have a few ladies who came down with very advanced breast cancer. Being one of the few doctors in the church, we were asked to help. But I must tell you that I was really helpless. You know, we did not really know what to do. And when we go there, we dare not use some of the medications. So that was the beginning of my journey. Later on, I went to do a course, and that's how I got started with the palliative care till today. I just want to introduce you and give honor to people who go before me. Okay, Dr. Tang Kwang was the key person. He was an ex-director of medical service for Sarawak, and he started the cancer care. At that time, we call it the cancer care. And Dato Sengutta took over, and then now our present president is Dr. Lam. So what do we do? As a whole, the Cancer Society, what we do here is that we gather volunteers, doctors, nurses, and lay people. We want to actually extend care to those who are terminally ill. And this is the mission statement and what we are doing in the Cancer Society. So hospice care is just one of those things. I won't go into this. And these are some of our office staff and what we are doing. Sometimes we do exhibition and we participate in awareness campaign. Okay? So the purpose of the palliative care is that we want to prevent and relieve pain and suffering. Okay? We want to assess the patient correctly and give the appropriate treatment. And we want, the most important is quality of life. So our emphasis is really with quality of life of people who have life-threatening problems. So what are the really life-threatening problems that we deal with? Our society and my scope of work is mainly deal with cancer patients. Okay? But there is another big aspect of palliative care are those deal with organ failure, like kidney failure, when you no longer go for dialysis, or some of them severe lung disease, severe heart disease, liver failure, and another small group is a HIV infection. Okay? So what we are doing is just one small aspect of palliative care. And so our main emphasis is really to improve the quality of life. We deal with, number one, physical problem, means pain is the main one. Sometimes it's breathlessness is the main issue. And occasionally is other discomfort like what we call ascites, means actually a lot of fluid in the tummy where the tummy is all swollen out. And we also try to help with the psychosocial. You see, psychosocial problems are plentiful. Later on, we can, as we go through, we will try to just share a little bit with you. And last thing is spiritual. It doesn't mean it's the least important, because then when we all face with this particular problem, like when we see that our life is limited with a certain time frame, then we begin to want to always find out, is there a meaning in this life? Okay? So that is what the spiritual problem we are talking about. Okay? Then what is important is, you see, what is actually suffering? Physical, of course, pain is a suffering. Non-stop vomiting is a suffering. Breathlessness is suffering. But another aspect of the suffering is to manage expectations. If our expectation is very high and the reality is very low, then this is part of suffering. If we expect to live very long and yet the reality is going to be short life, then if we cannot accept that, that itself is a mental anguish. If we expect that it will be completely pain-free, but we cannot achieve the reality of being pain-free, that is also considered as unmet expectations. And in the hospice care, we try to meet the expectations. So the key issue here is the moment someone is diagnosed, And then the moment that someone is referred to us, the key issue is communication. This will apply to any sickness. Or if you look at this diagram, here I just use cancer as an example. That first, you diagnose with cancer. Of course, not all cancer patients will end up being unable to be treated. Now, with modern treatment, in fact, quite a good proportion of cancer, if you diagnose early, they are treatable and they are cancer-free for many years. So, first, at diagnosis, you have specific treatment. As you go down the line, when the treatment is no longer effective, that is when slowly the palliative care, or we talk about palliative care, then slowly take over. Then finally, of course, the ultimate end of life came. Then we did not stop there. We try to give the family bereavement support. Then I will share with you a few cases that we have dealt with. So that is actually part of what we are doing. Bereavement support is part of what we are doing. And I also believe that as a body of Christ, we can actually help a lot along the way. You can help to hold their hands while they are around. Then you hold the hands of the family at the end. You see, in reality, or a lot of time, we expect we have good health all the time, and then suddenly we say bye-bye, okay? But in reality, this is very uncommon. Less than 10% of death happen this way. We say, oh, we have good life. God is so kind to us that we enjoy life until the last minute. Not true all the time. This is more common. Our health, as we get older, start to deteriorate. Then we treat a little bit, it get a bit better, and then it keep on. But each time, it get a little bit worse until the end. And so this sickness can drag on for many years. These are another scenario where you have poor health for a long, long time and gradual deterioration to reach the end. So what are the issues that we deal with in hospice care? And we deal with a live person with a feeling, just like all of us. And first of all, this may not be the whole list, and this may not be the order. Number one is denial. Cannot be, when you go and see and you find a lump and then the biopsy confirm it's not so good, the number one most of the time ours is we say cannot be. I'm live such a healthy life, I eat organic food all the time, cannot be, right? So that's when sometimes we avoid treatment, or sometimes we seek multiple opinions. And second reaction would be we get very upset, angry with everybody, angry with the doctors. That's when they will sue the doctors for, or angry with the loved ones who are looking after them, and start to blame. Must be the food, must be this, must be that. And they blame God sometimes, right? Why should it be me? I'm such a good person. Feeling of sadness, feel miserable, feel depression is very, very common, okay? Then your anxiety, you don't know what is going to happen. Especially if the person who get it is the breadwinner, okay? It's the only breadwinner in the family, and then when they got it, what is going to happen to the loved ones? What happened to the young kids? These are of great concern. Sometimes it's of more concern than their own health, right? And of course, you feel guilt, guilt is this, that if they're going to depart from here, what happened? Why they brought the kids into this world and cannot look after them? And these are things that will eat into them. And grief is, of course, is the same. You know, they just feel so sad about what is going to happen. And the other things that they will learn to do is learn to adjust. Okay, say like if they can't walk anymore, they probably had to go on the wheelchair. They had to be adjusted, and they may not be able to go to office to work. They may have to work at home in certain circumstances. The final one, which we hope all those we look after, is acceptance. Because it's with the acceptance that's what you can plan and you can live life to the fullest. You know, the whatever time being, whether it's days or months or years, but you learn to live to the fullest. Learn to enjoy your loved ones, to enjoy whatever what has been provided for you. So, but at the end, it's like this. The part that we also deal with is bereavement. Bereavement is really in the beginning, no matter how well we are able to accept the inevitable, but mourning and grief is really part of our human emotion. Okay? There is pain of loss and separations, and there is despair. Don't know what to do anymore. And finally, is they're able to accept that the particular person has departed, and they learn to live and carry on with their life. Okay. So the issue of loved ones in our context as Chinese is actually very important. I'm always very thankful to see that we all, as Chinese, we have extended family. We have extended family support. That is not so in a lot of Western society. People live on their own. But here, unfortunately, I think we are beginning to see some very peculiar problem that we have in our society. That we tend to send our children overseas to studies. And a lot of them stay overseas. So now we have two old person. You look at me and I look at you, and you know what happened if one gets some untreatable illness? There is really, in a way, not much of support from your children. Okay, but that is almost like a reality, because I am also involved a bit in the nursing home. So you can see that actually it's very sad. When you talk to them about their children, they're all so proud of the children, doing so well overseas, but they themselves end up in the nursing home, right? So the relative here is we are slowly, the structure is changing. So sometimes I always joke and say, what is being blessed, okay? Is it being blessed means children all very well educated, all professionals, all doing very well, but yet very far away? At the end of your life, what is considered blessed? And I always remember that I was in Patukawa, one of the sort of very rural area. I have this old lady who is quite ill, but the children all stay nearby. So there is so full of people around her. So it was one day I was there, and all the grandchildren came. So I said, you know, they are all about maybe around 10 or up and down, around that age. I said, why not give your grandma a massage? Wow, suddenly all of them jump on her. So all the 4 limbs are taken care of. Wow, you can see her face. She was so happy. And I thought, wow, that is being blessed, isn't it? So to have the loved one with you at the end of life is a tremendous blessing. But here we also have another issue with the relative when we come to end stage. Is this that sometimes the relatives are the one who really make the sort of management very, very tough. Okay? If we say that we need some very strong painkillers, for like we use morphine a lot in the hospice care, and that is the only one probably works. It will not shorten life, but the morphine has a very bad name, right? Because everyone you hear that the drug addicts that use morphine, but the way it's used is very different. So some children will say, no, you cannot use it, you know. So then what are we going to do? Because we are not there to try to cause problem, to fight with the family, but at the end, the old person really suffer pain that is avoidable, okay? So because of that, we also sometimes sadly witness many disagreements among the members. Instead, they come together to enjoy the time with the loved ones for that very limited period of time, and now quarreling. Sometimes you see, I like this picture. Our old age, if we can enjoy this, that is quite something, isn't it? It's not something physical. We enjoy the relationship, and that's, I thought it tells a lot of things just from the picture. And this is a couple that I look after. Actually, the man in his 90s and the ladies in her late 80s. He is the one who is very ill, but he insists that the wife must sleep next to him and hold her hand, and that was really sweet. That is part of hospice. We always say that we are not living alone. We live in a community. Our home is a community. Our church is a community. We hold hands together. Okay, now we talk about what do we do. Sorry, I try not to speak in Mandarin. Otherwise, I think it will be too long. Okay. You can ask me in Mandarin if you want to, but I'll just go through quickly, and I hope I don't take up too much of your time. Okay, the psychosocial part, which we're trying to say, is good communication. We communicate with the patient, say what can be expected of our care, what we can provide, and what we cannot provide. And we usually try to meet the family members and explain to them what is it all about. You see, one of the questions that always asked is, how long more? And I always tell them, we really don't know. I said, God only knows. None of us know. Some can look very ill, so breathless, like going to go anytime, but they can drag on for weeks. Okay? Whereas some, I always remember there was one guy that after my clinic, I went to visit him. Then that day he was very happy. He was walking around and he served me tea and introduced his son who came back from overseas. He said, this is my son that I have been, waiting for him to come back. And I reached home. Before my dinner, the phone call came, said he passed away. So sometimes we really do not know. Somehow he look as if that he's with expectation. Then that is his last wish, and then after that he just go. So in a way, life is really a mystery, isn't it? None of us really understand it all. So second aspect is spiritual care, and because National Cancer Society is not really a Christian organization. It is actually an NGO. So we're trying to be really quite careful in the sense of what we do. Basically, we look after quite a bit of Muslim then some Buddhists, and of course we have our fair share of those Christian brothers and sisters. So basically, one of the things that people at that stage in life say, what is the meaning after all? What is it all about? You know, life seems to be really meaningless, you know. Worked so hard, brought out the kids, and then now it's about time to enjoy life, and then there is no more, you know. So, and the religion that the person has sometimes really determine our outlook, okay? Our outlook and our meaning in life is determined by our belief and our belief system. So to be able to really accept what we have is really one of the most important hurdles that we need to overcome in this kind of situation. To be able to forgive, in actual fact, something is very beautiful. Sometimes we see somehow the patients, knowing that life is limited, able to reconcile and forgive all the loved ones and the friends or whatever whom they have really either offended or have misunderstanding, and they bring peace to themselves. Okay? And they make peace with the fellow man, and they make peace with God. And of course, we also have come some that who is angry with God in particular until the very end, because they cannot accept that, and they just claim that God is so unfair. Okay, there are worse people than him or her, and yet they are so okay. Sometimes I always joke and say, bad people live longer. Yeah, okay. So then also that what we shared before is guilt and shame. You know, sometimes when people have some sickness, they hide themselves. They don't want to let anybody know, because as if that suffering from cancer or any sickness is a shame. Okay, and they do not want to tell people. And some, of course, equal sickness to divine punishment. There must be something that I have done wrong. God punish me. Okay, and we also trying to do in a way that to explain to them, make sure that they do not have false hope, because you see here in Christian faith in particular, we believe in divine healing. I mean, definitely, I personally believe in divine healing, but we also see the inevitable. Even those who are healed divinely, also ultimately we got to depart from this earth. So it is passing away is part of the process of life. Okay, so when we talk about pain, we talk about physical pain, basically pain itself. You see, the cancer pain is very, very different from our stomach ache, headache, or something like this. Cancer pain is actually really, really painful. Okay? And therefore, they need very strong medications. And usually we tailor them, start with the mildest, and slowly increase. Fortunately, with the modern medications, most of the pain can be controlled. Okay? Most of the pain, so patients do not need to suffer unnecessarily. There are many other ways of besides physical sort of medications, even things like massage also help. Some of them even acupuncture also help. So there are different ways of treating it, but by far the one that we use the most is basically painkiller, usually by oral, some of them through the skin patch, some of them by injection. Okay? The psychosocial, as I shared just now, the spiritual, I have shared it. And the last part is financial. Financial can be very, very painful. Okay? Number one is this, that the cost of modern treatment is very expensive. Okay? And normally the loved one do not spare any money to try to treat the family members. Okay? And that can really exhaust them. And some of them sell off their houses for treatment. And fortunately, in Sarawak or Malaysia as a whole, we still have government provision for free health care. Of course, some of the cancer medication may not be available, but if for those who really cannot afford, the government also have medication, but may not be the medication of choice, but it's still something can be done. So financial, we have seen so many that some of them really bankrupt by the end of it. When the sickness reach the end, financially they are really literally destroyed. And some of them are so poor, have even no finance to buy casket. Okay? So these are the kind of situation that in our country, in Kuching as a whole, if you just go slightly outside of the town, you will see some really poor people. And some of them, I have seen a house that have no four walls. It's a squatter house. The wall is being pasted with plastic sheets. The floor is elevated house, about probably 3 or 4 feet from the ground, squatter. They have alternate plank because I think there is not enough wood. And that's how they live, Okay. So our aim is we want to help the patient to have better quality of life, okay? To whatever amount that is. Our main job, of course, is to have symptom control, which we've gone through before, but these things do not come with just one person's effort. Okay, my team, we have nurses, we have other volunteers, but unfortunately in our team we do not have like full-time social workers. We don't have psychologists, but occasionally we do ask for help from the psychiatrist for certain medications that is needed, especially some of them who suffered some great mental anguish, and some of them have hallucinations at the end. You see, hallucination at end stage of life is very common, okay? So sometimes when they are very ill, they hear things, they see things, and which medically we think is really something wrong with the body system, especially the mind. Of course, then people attach a lot of things to it, that they're seeing those who have passed away come back to get them, and things like this. So sometimes the story itself can be a bit frightening. Then we also to ask the priests or the church pastors to come and help for those who are Christians, especially whatever denomination they are in. And the Buddhists and the Muslim, somehow we find that they have different way of dealing with it. Really, I'm more familiar with the Christian group. I have a Muslim nurse, so whatever the Muslim affair, I just let them go and deal with it. In a way that the system is a little bit different from us, and because somehow they seem to accept this a bit better than us, I think a lot of times say God's will, and that's about settle a lot of issues. You see, what we are doing is basically community hospice, okay? That means that we actually look after patient at home, okay? If a survey is done, majority of people actually wants to die at home, unless the circumstances don't allow. Our local population, if you stay in the rented house, the house owner don't allow you to die there. Okay? That is the unfortunate part. They think that your house value drop after that thing happened. Okay? So, but common survey show almost 90% of us prefer to pass on at home. That is when familiar environment, your family members can be with you. Whereas in the hospital, limited visiting hours, one person can be there only. And when the nursing staff are so busy, you need something, you may not get what you want. So that is what it is, okay? This is a Western figure, say that 70%, but I think in our local population is probably close to 90%. We will not go through this one again, we just skip this. Okay. Another things that we provide for is our society has some equipment we loan to the patient. Okay, we trying to give them hospital bed, commode chair, walking frame, wheelchair, and so that they don't have to buy them. And whatever we have is given out for loan for free. Okay, and we also try to promote hospice care. Okay, these are some of the things that we do. We visit them, and you see all the masks and all this is because of the COVID. And this one is bereavement. We try to, if possible, to attend the funeral or the wake service in some of the cases. And that sometimes is good so that the family will really feel that we are there to support them. These are a number of cases that we have. The number of home visits over the years actually have increased quite a bit over the last few years. So since we have the full-time staff for the last few years. Who can refer patient to us? Generally, we would prefer that the doctor in charge of the patient refer to us, then we take over and look after them at home. But we also accept people who just patient on their own refer to us, but we will try to work out what they were on and who were seen then, and we get the information from the doctor concerned. So if the public or anyone or any of your friends that you know of, or that any person who need help, we are usually trying to accommodate everybody. So at any one time, at the present moment, we have about 40 up or down a bit. Our turnover is very fast. Every week there will be a few who pass away. At the same time, we will have a few adding on to us. Okay. You see, these are some of the things that we deal with. I don't want to share some of those who really may make you sleepless tonight. These are really some of the things that, one is on the colostomy side, these are tumor on the head and neck, and one the tumor on the leg, and the other also tumor on the leg. And the one on the left side is a breast cancer, and these are a lot of the mouth ulcer that we see throughout when the immune system is down, you tend to get a lot of mouth ulcer. And these are some of the worst things that we see is back sore, okay? And if you don't move and don't management, and these are totally, the whole problem is, these are totally preventable if we look after them well. We don't have, these are neglects, that they are not looked after, or sometimes they just don't know what to do, okay? So these are different types. The one is head and neck up there at the neck, and this is the breast cancer spreading to the armpit, and that is the armpit. And okay, so ultimately I always say that the Bible say that there is a time to die, but really all of us, whether we are living now and perfectly healthy, but there will be a time. So in a way, sometimes it's something very solemn. Sometimes to think about that. Yes, we see somebody, but ultimately, all of us will have to go through this journey. And sometimes what is considered, we always joke and ask among ourselves, what is a good death? You know, what is a good death? I mean, of course, Chinese sometimes say that, 衰啊, huh? You know, how can you talk about death, right? But the reality is this, that it's something inevitable. So we define it as that a good death is one that is free from avoidable suffering for the patient, the family, and the caregiver. We must, you see, when one is sick, actually the whole family is sick, right? And that is how the whole society structure is like, okay? Okay, and that is our life, right? That ultimately will be there, okay? So I want to share a little bit with you that about death. I think I probably have seen, witnessed many deaths. Some of them breathed their last while I was with them. So to a certain extent, I respect life, okay? And I also respect the dying process. It is something very, very solemn. When you see someone breathe their last, it really hits on you and also give you a sense of the solemnness and the sacredness of life, you know. So ultimately it's like this. I feel that, number one, it is really certain, all of us. And really, if you look at someone breathe their last, is the last one I see them, they breathe out and don't breathe in anymore. It really makes all of us same. Whether you are rich, whether you are professional, whether you are laborers, all the end, we are sama-sama, the same. And we don't have a choice. It's not our choice, okay? And ultimately, actually, no matter how well you are prepared, we are actually not prepared, you know, to a certain extent. But it's better to prepare a bit than don't prepare. And like it or not, there is certain amount of fear in all of us, okay? We won't go into this. But generally, I want to share with you that actually cancer is very, very common, okay? 1 in 4 of us will suffer cancer in their lifetime, okay? Generally, the 3 most common causes of death, 1 is cancer. I mean, 1/4 of us will suffer from cancer, but not all will die from cancer, because some of them, as I say, are curable. 1/4 of us will have stroke. 1/4 of us will have heart problem. Okay, so that is the 3 major. No matter how each country you look at it, that is what it is. Okay, actually, this is a very short book. It's a very interesting book, written by a doctor, a Christian doctor. Very short book. He has cancer himself, so he wrote about himself. Okay, and what the process had he gone through. The last chapter, of course, he couldn't write it. His son wrote the last chapter. And it gives us a Christian perspective. He is a king Christian, and he wrote this book. You see, after 20 over years doing this, what have I learned? Actually, I learned a lot. Learned a lot about life. As I said, one, life is sacred. God gave to us is sacred. That death, to a certain extent, is the mystery. Okay? In our setting, when it comes to the medical aspect, it's important to have early referral so that we are able to know the patient and know the family, we can help them. But unfortunately, some of them refer to us when they're already gasping, really fighting for breath. And some of them, we just go there to witness the final moment and can't do anything. We can't help the family at all. The last thing I want to is to talk about will writing. Okay, I think I don't know. I know that some families just don't. Some men, particular, don't believe in it. Okay, they think that it is bad omen if we do that. It's bad luck if you do that. But please do it. Okay, because we are seeing enough suffering for the loved ones. Sometimes the man is the man of the house, and the ladies have almost like don't know where is the money, where is the account. And we have seen even family that when it happened, and especially when the owner of the house, that they don't know what to do. There is no money for anything, because even though the person got money, but they have no access to the money. To get a probate will take months, So we must be kind to the loved one, do our will, do things properly, okay? And sometimes I just share this with you. I'm not a pastor, okay? Share with you that, when we say it is finished, and when Jesus said it is finished, then he gave out his spirit. I always say, well, it is whether all of us will have that option. If we knock down by a car, of course, that we have no chance to say we give out our spirit, right? But in the patient that we have seen, like sometimes we don't know why this one go away so fast, And some seems to hold on until, say, we have seen some who wait for the son's wedding to be done. Some wait for the so-and-so's birthday to be done. Some of the children to come home. And it's really quite interesting as a whole to observe it, that somehow, whether we have this ability to give up our spirit or not, I don't know. And okay, then there is another one which we don't practice much here, but which we hope to encourage, is what we call living will. A living will is a directive that you write while you are of clear mind, when you are healthy. Say that when something happened to you, what would you like to be done? Okay? Say, would you want, say like, if you're very sick, to be put on the ventilator to just prolong your life where you have no life? Okay? These are some of the things, We do have patients who leave a will and tell the children, at least verbally, saying that I don't want anything to be done. Okay? Don't want to have a cardiac resuscitation. I don't want to have a tube on my throat and with tube all over the body. So this is called advance directive or living will. That means the same thing. It's not well practiced, but I think it's something good to do. You may not be written, but maybe good to really get your loved one to know. Why? Because we have seen many good families broken down because of this. We have one, a friend of mine, where the mom was very sick in ICU. Half of the family say, don't try anymore because it's just too much suffering. And the other half say, how can, this is our mom, how can you don't try your best? They literally fight inside the ICU. Okay? At the end, don't bring glory to anybody. Until today, years later, they don't talk to each other. And they blame each other for what happened, which is actually to me was inevitable. This is my last slide, okay? This is a squatter house. Inside the house, the floor is just earth, And this one actually belongs to a nurse who passed away. Unfortunately, she was a single parent with 2 young kids and stay in the squatter like this. So there are many of those who are living really at the margin of society, and when they suffer sickness, they really suffer. So we actually, one of the things which is not really on our duty list, we sometimes trying to help these people, trying to raise funds, because we are not a charitable body. Yeah? So sometimes we turn to some of the churches. Our church member actually has been very supportive to able to provide some of these really needs for them. Sometimes even buying food for them. Sometimes we have a situation where there was this single lady. Maybe I will end with this story or just share with you how I appreciate our church people. When I say church people, don't mean my own church, but across the board has been very helpful. Years ago, we have this lady whom was brought to us. She has, by the time when we saw her, she has breast cancer, advanced breast cancer, spread to the spine, and she was paralyzed. And she has a huge ulcer at the back, and she has 6 children. When she was pregnant with the last child, she discovered to have a breast cancer. So she have a choice, right, to terminate the pregnancy and go for cancer treatment, or you wait until the baby is delivered before your treatment. So she made a choice. She kept the baby. So by the time she delivered the child, the tumor already spread. Okay? Sometimes breast cancer during pregnancy spread very fast. So that the husband left her, no, during the pregnancy, because somehow he just couldn't take it. He left her. So the husband took 3 kids. She got 3 kids with her, including the youngest one. By the time we actually saw her, the kids was a few years, about 3-4 years old, was killed. But she was staying really with a relative just outside with one single room, a whole family inside. So one of the church members, I think was from the Methodist church, one of the developers, helped to build an extension of the house, build a kitchen for them. We have some church members who, because the children need to study, bought a computer for them, fixed out the internet for them, and also finance the kids to go for tuition because they were really totally neglected. So these are out of what we are doing, and we just really source it out to particularly the church community as a whole. So actually the biggest hospice in Singapore is church-based. It's called St. Joseph Hospice. It's run by the Catholic Church. They have 100 over beds. It's one of the biggest in this region. They are running the inpatient hospice. Of course, there are far more numbers that actually do home care hospice. So that's all I want to share with you. Sorry that I'm so long-winded, okay? And if you have any questions, I'll try to answer them. Thank you so much. Yeah. Because there are especially people with stroke and all this. So, but you can actually rent it from this life care society. There are some other charitable society, you pay a small amount, they will rent it to you. Okay? They will deliver to your house. So for us, it's like this, that generally, I cannot promise those non-cancer patients that we will pass all this to you, but unofficially we have done a little bit. But we don't want to advertise it because then we will be overwhelmed, which we cannot manage. So we only, in theory, we only look after the cancer patient. Yeah.
Second question, living will and advance directive. Is that effect? I mean, if somebody has it, say that I've done the living will, more legal and so on, is that acceptable in Sarawak? I know in Singapore they have that. It's legal.
Yes.
But in
Malaysia, we have, as far as I know, okay, it's not as legal that you can enforce it, you know what I mean? It is a legal piece of document, but how far we want to enforce it. Let me give you an example, okay? Years ago, I received a phone call from somebody, some family from Lundu, okay? And this guy's son said, my father passed away. His will is to donate his eye, okay? So we all, in a way, a bit excited because then we can transplant 2 patients, right? 2 eyes. So we prepared to go. Before we even left Kuching, and they call out and then say, sorry, cannot be done because my brother objected, okay? So here, of course, we cannot say, oh, you agree already, we must take it, right? Then we'll cause havoc. So in our setting, we usually let the family sort it out. Even though there is, whether it's written or not written, because we really, really do not want to get involved with all these complications of the family. You know, it's very, very difficult. Even say, for example, like we have one lady, okay? Half the family, very strong, very keen Christian, half devoted Buddhist, okay? So like, okay, what to do, okay? So we actually able to share good times with her when the Christian kids were around. And so finally, when the time comes and she passed on, what kind of funeral rites there is? So it's like, almost a fight, you know. Finally, the Buddhist one won. You know, they do call the mum-in and all this. But I thought maybe people pass away, who cares, you know. So it's important when they were living. So all these little things about what to do, really in the little experience we have, that we try to let the family sort it out, you know. More so actually in the one that we hear we're doing is that we do not want to prolong unnecessary suffering. You know? Say especially when someone who on the ventilator. Not too long ago we have one particular situation where the family say, you mean you do nothing? They fly back all the way from Australia. I said, oh, you do nothing? Now I sit down with them and say, yes, if you want, we can do everything you want to do, but you have to bear the consequences. I said, okay, we put the lady on the ventilator. The cancer was actually so advanced. We can keep the breath going by the ventilator, but one of you got to make the decision when to take it off, right? So that is where the situation is. You know, in overseas, you put on in a situation, sometimes you need a court order to stop the ventilator. It's such a complicated process, and it's such a tedious process. So finally, they decided not to put it on. I'm so thankful that they don't, you know, because if we get caught in between, sometimes it's in a no-win situation. So living will, I think, is important, especially when the illness was diagnosed. Okay? Besides, of course, the will itself, the proper will about how you distribute your wealth and all those things is separate. It's a private matter. We also encourage, because we really have seen some that is so sad, you know, so sad, especially typical Chinamen, that sometimes they are the only one who know what is going on, you know. The wife, the children don't know anything. I think I must encourage everybody must have joint account, you know. Oh. 讲一点点OK， 我明白其实的话，就本地来讲呢，最普遍的就是说，你眼睛跟肾脏 kidney， OK？ 如果你一个人病人是有癌症，他们不适合卷，
所以癌症的病人我们大多就是不要了啊，因为我们是怕是说癌症的细胞已经传到这些器官，我们是看不到的。所以说大多是其实捐献这个器官都是比较重要的，就是你要捐的都是大多是意外的这一类病情或者是中风什么什么身体还是强壮的，器官还是强壮的。如果在吉隆坡偶尔可以捐你的心脏你的肺你的肝不过这些都是比较少，在本地来真的是很少。我做眼科做差不多40年了，我们只有做2个眼睛补精大多是我们家人都不要了。我们尤其是我们华人不要，回教徒更不要，我们的一般也是不要，所以说很少很少。其次的话，如果像我们这种地方洗肾这么多还是不够用一部分的人其实如果有人捐献他的肾脏其实可以transplant的，可以做的不过是说事实上是找不到捐什么？你听我讲现在照我所知道的我们以前读书的时候，我们是有人捐身体的，不过一部分是买的。那时候我们觉得我读大学，他们是印度买来的我们说笑，不是真是假，可能是人家在街上去世，没有人要，他们拿去卖不过我们不知道，不过是有人捐。如果在我国捐你整个身体，就给人家是需要去研究什么。不过我们现在你知道他们是做什么？就是 IT 的，没有真正的现在的医学生没有真正的机会去动这个东西都是 IT 的，你切片他们给你看你怎么样所以没有这个机会。
现在在我们马来西亚有这个 organ donation 这里也有sign up 这个卡，很重要的是那个有一个 condition， 你要通知你的家人，你家人知道说我已经捐了我的内脏，这很重要。是刚才这个所讲的这个人还要捐可是家人我知道现在我们有一个目标，还有吗？没有的话，我就请是很简单的做一个summary。来，我们看看讲错的就 OK。You just do a very brief summary.
Yeah,
OK.
我有点紧张。就我第一次听到这个题目的时候，给我是非常新的一个体验，然后觉得很新啦，这个一个东西，然后这真是我人生中第一次听到这样子的体验呢。那么也是在这边谢谢Tiong给我这样的一个机会能够听到这整个东西啦。那么相信在座的，那么我非常感动，刚刚我听到的是Tiong他是由爱先作为出发点，那么在他感到无助的时候，他有这颗爱的心，那么他就开始了他整个这个旅程。所以我们我这边真的是很谢谢他。那么在这个整个故事，我也是有听到，就是可能我们像华人每次讲的百善以孝为先，所以我觉得可能在一个人在可能临终的时候，可能他会需要到一个这样子的我们讲就他过世之前，我们就尽量给予我们的爱啦，因为不要等到可能家人过世过后，我们再给的话，就可能来的更多是纠纷或者是一些的争论的一些话题啦。所以我觉得作为因为我本身也是一个单身的一个家庭长大，所以能够知道那一种可能因为人家也是跟我讲，因为我小时候就人家跟我讲，可能我们善是以 在他去世之前，我们给予这个善呐、所以我是觉得这样子的一个话题是其实给到我们这些像年轻人这样子的一个鼓励啦，所以谢谢 Dr. Tiong 那么其实我这边就没有一个 brief 的 summary， 因为其实我是第一次听到，然后我只是分享我自己给我听到了一些我的这个感动啦那么请在这边再问一下在座有什么其他的问题想要再问吗？因为有吗？有的话可以勇于发问没有问题的呀。OK 如果没有的话 ，OK 没有的话，我们这边也是请小娟牧师上来，我们有一个小小的心意要给Dr. Tiong 我们请小娟牧师。好，谢谢Dr. Tiong，我们再给一个鼓励好，谢谢Dr. Tiong。那么在结束之前，我们请小娟牧师为我们做一个结束祷告。
爱我们的爸父神，我们真的是感谢你。你今天晚上在提醒我们每一个人有一生也有一死。当我们有年日的时候，天父请求你自己教导我们活着有充满你的恩典，充满你的爱。我们也感谢天父，你今天晚上让我们学习到怎样的继续关怀尤其是有病痛的人。天父请求你自己继续的看顾我们，保守我们让我们每一个人会后的脚步，主你都保守看顾，而且让我们每一个人有今天晚上有美好的睡眠明天都能够回到你自己的圣殿当中，一起去敬拜你。弟兄姐妹，现在但愿我主耶稣的恩惠、天父的爱、圣灵的感动常常与你们众人同在，从今直到永远。Amen. Please be seated. Good night. And I think Dr. Tiong is around. You can ask him some questions.